Welcome. There are changes happening in the world at an amazing rate that touch just about every aspect of our lives, from how we travel to how we get the latest information and how we communicate with our friends and family. And the way we will be cared for in later life is changing as well. We'll have the opportunity to have more say in the services that we require and from where we obtain those services. After all, we've managed our lives for so long. I think that's a progressive change in a positive direction. Consumer-directed care, or CDC, is a way of delivering services that allows a consumer to take greater control of their own lives. It allows a focus on an individual's goals, such as independence or staying well and healthy, and it allows them the freedom to choose the services they need, the services that will make a difference to their quality of life, and it also offers choices over who will deliver those services. Approved providers and consumers will work from a basis of respect and collaboration, and it will be up to the consumer to determine how much control they want to exercise in their care plan. Consumer-directed care is about finding the best way of using any aged care option. It's about choice, control and flexibility, no matter what the setting. As they say, the only constant in life is change. Embracing these changes will encourage independence and active involvement for all. We've put together this short video to help you understand how CDC can work.
It's actually given us a lot more freedom to do a lot more with our clients. We have permission to do things a lot differently to what we normally have done, which has been great.
This is about doing things with people and not for people, creating a plan for them. That might include things like transport or nursing assistance or aids to help them stay living at home safely, but each plan will be tailored to suit that person's needs. The new system is about enablement or re-enablement in terms of helping people get back on their feet, perhaps after they've had an illness or an injury, and it's getting them back to being able to do the things that they were previously able to do. So as a service provider, we like to look outside the square when we're looking at people's individual plans. So some people might need to or want to send their laundry to the laundromat, and somebody else might want an exercise program for seniors. We'd like our staff to think about what it's like to walk in the shoes of our clients or consumers.
I don't want to be a burden to anyone, but I want to be involved in picking the services that I need and want, and in that way we can work as a partnership.
As soon as I realised what can be provided, then I got what I needed when I needed it, and that kept me independent.
I've had some really good outcomes with clients, some great success stories. We're working closer with them and it's kind of rewarding. You get a real buzz watching people meet their potential.
The budget is the sticky end of the conversation. It's important to realise that every person has an allocated amount of funding, and the budget helps us manage that funding. Of course, every client can top up their package of support, and there are guidelines around how service providers will work with you to put that package together. One final thing about budgets: every consumer will receive a monthly statement, just like a phone bill, so that they know where their funds have been spent, how much has been spent and what's left over. If there are funds left over at the end of a month, it can be rolled over into the next period. It is important for service providers to work with consumers and their representatives to stick to that budget as closely as possible. It's important to realise that the funding is for that individual's care. It can't be used by anyone else.
I've always been in control of my finances, but I don't mind contributing to some amount to the expenses. We work on the budget together and they give me a statement every month, and sometimes we mightn't spend that month's money, but I know that it goes towards the next month.
There's always information on the My Aged Care website. People over 50 are accessing services and packages. There are different levels of home care packages, from high to low. Some people will need low levels of care to stay supported to live at home, and some people will have higher needs. So there are other criteria, and this can include physical, social, psychological, medical or cultural needs. And once somebody's been assessed, they can be referred to a provider, or they can be given a list of approved providers and go and choose their own.
I work in residential aged care, and consumer-directed care is really starting to have a good impact on our residents. Wherever possible, we give them choice about what services they want, how they're delivered and when. A lot of the things they've enjoyed in the community are available in-house, and they get to maintain some control over their life.
Case management when it comes to consumer-directed care involves a few steps. There's the initial assessment with the person to understand what they want to do, even understanding their goals, even their dreams. Developing the care plan that helps them reach their goals and their dreams, supporting them, re-abling them in that journey. Developing the budget to provide the supports that are necessary. Monitoring that budget, continuing the assessment as needs change, and of course referring on to other services where necessary. So case management can be quite overwhelming and in-depth at first, but it is all about helping the consumer take control, empowering them so they can meet their goals, so they can be independent, enjoy flexibility in the delivery of services to help them on their journey.
Yes, they do giving me independence without me realising, the help that they're giving me.
I love playing cards with my mates, especially on a Friday, and I love the fact that I have transport to and from the card game, otherwise I wouldn't be able to play.
So what does consumer-directed care mean for a worker in community and residential care? Well, it means listening, promoting choice, encouraging strengths, encouraging abilities, following a care plan, and reporting any changes.
It's a nice shift. It's more individual and it's more personal, a bit more real for people. We just need to be open-minded, and think outside the box.
Through respectful relationships, consumers or their representatives and providers can work with assessment teams and contractors and subcontractors to come up with plans that address the individual needs and goals. The emphasis is on the individual, not on one solution for every person. There's always help available to answer any questions and discuss options and possibilities. It is a new direction, and change often brings with it concern and fear. In the words of Socrates, the secret of change is to focus all of your energy not on fighting the old, but on building the new.